Hey docs, how you doing? This is Dr. Fernandez. I just put this quick 2 minutes, I think it is, video together just to show you how easy it is to start with Pangea, getting the patients in and putting all the protocols together. For the reason I'm doing this is because I'm seeing some of the doctors actually getting really good results in the practice and some are not, and those that are not getting it is just because they're not using it. So I just want to make sure that all of you guys have the same chance because all of you has the same system and the same program using the same supplements. So it makes little no sense that why some of us were doing great and some of us were not doing that great. So let me just start right away to show you how easy it is to get the patients through the process and how actually you can use Pangea to put a really good clinical base and proven based protocols for your patients. So regardless from where you actually are getting your patients, right? If it is from let me just use the pen, usually it's easier. So regardless if you're getting your patients from assisting patients, your chiropractic patients right away, or if you're doing ad hoc, or if it is a one-on-one or someone that actually called to the office, the only thing you have to do is email them the link that you received so they can get to your unique Pangea account. Also, many doctors, what they're doing is actually they're having in their website embedded the IFA form. So patients just go there and click to fill out the new assessment, and that's how it works. And it's getting to the Pangea right away. Then when they get there, what your patient is going to do is basically fill out some forms, and those forms are going to take that information through Pangea, and then Pangea, what it does is analyze the information and then create a set of reports that are going to help you to create your clinical plan for your patients. And then you just use your time to give your patient what they're looking for: quality time and quality protocols that gonna that is gonna translate in quality results. And that's what we're getting from many of the doctors that are already using the software. So this is in summary what's happened. So let me show you now in a few slides how you can get that done. So let's say all of you, there's two ways, as we were discussing in the previous slide. One is using the emailing the link that you receive, and the second one is embedded the same link into your website. How that can get done? all of you has received one link like this in your first email when you start with Pangea. So you just have to type the email of that patient here, but fill out initial form or follow up. In the beginning, the initial forms is just fine, and just email it to them, and then just click it there so they can start filling out their assessment. The second way to do it is you can embed it, like, and this is one of the this is actually a screenshot from one of the doctors. She did a great job here. Fill out forms, and she have some forms for the direct lab, and she has in a big screen fill out Pangea, and she tells to the patients, hey, when you go to my website, go and click fill out forms and then click out Pangea, and then just follow the process, because it's easy as that. Now what the process means, what your patient actually are going to see is this. They're going to see in the beginning, the software is going to ask them some basic information for them to create their own account. Then when that information is done, then it's always helpful if you tell your patients that when they start filling out the form, there's going to be two forms. One is the IFA form, and it's going to be looking like they fill new assessment, and number two, fill out the electronic medical record. We're then done with that. Then what happened when they fill out both is that the software, it will analyze and it will provide you as a clinician. It will provide you with the clinical data. This you're gonna find in the EMR part of the software. It's gonna give you a report based on functional medicine philosophy from the questionnaire. This you're gonna find in your IFA. And also it's gonna recommend some basic testing to be done, and those tests is gonna and that report is gonna give you the name of the test. It's gonna give you the lab that needs to be done and why is it recommending that test. And this you also gonna find it in the IFA, in the IFA section. So far your patient, you just send the email to your patient, right? You send the email to your patient, and then when you send the email, they go to your website, they fill out the form, and from those forms, which is basically the IFA plus the EMR, you're gonna receive these 3 great reports that are gonna help you to make the right clinical decision. Then when you put all this together in order to put your plan together, then is a number 4, and this you're gonna find in the EMR. It's also gonna give you some protocols already in the EMR. You're gonna find this under supplements, recommended supplements in the EMR. It's already have embedded some basic protocols for you, and is do so by section. So gastrointestinal system, cardiovascular system, and then inside those section what specific conditions, and then you have there the supplement names, who made it, and the recommended doses and how to give it to the patient. So it's really easy as that. So now then all what you have to do is when the patient comes to your clinic, dedicate the time to wow the patient doing 2 things, right? Because now before the patient comes to your clinic, you have all the report, you have all the tests that you're planning to do, you have time actually to be more prepared for your patient. So now it's down to wow and take time to educate them, and for this you use the viewer, the simulation part. So when you get to your Pangea, you go to the icon, click there, and it's gonna be customizing the education for every single patient, and then you can just discuss the protocol and how the plan should be for them. So you see how easy it is. So putting that in consideration, let's review what we just have done. So basically what we're discussing is, regardless from when your patients come, just make sure that they gonna go to your website or you send the email so they can fill out the form. Based on this form, what the software is gonna do, which is step 2, is gonna analyze the data and is gonna give you some basic reports so you can make a better clinical decision in the process, so you can create the plan for your patients, and then the patients can come out of your clinic with a full and clear plan what to do for the healing process. So, and if you still have more questions inside your Pangea, you're gonna have under Know My Pangea tab, you're gonna have a bunch of video there just telling you how to do every single step in the way. But please, if you have any question at all, I'm available 24/7. This is my email, so just email me, or you can text me or call me to my cell phone. This is my personal cell phone. Yeah, if you cannot get a hold on me when you call me, please text me and I'm gonna call you back as soon I'm available. So I hope this video was helpful. I definitely want to see you in the top, and I look forward to talk to you. And if you need some extra time in one-on-one using the software, I'm here, and I'm available. So you please use me. Have a great night. Bye bye.